So my name is Jakub Bijak from the Department of Statistics and Demography at the University of Southampton and the Center for Population Change. And it's my great pleasure to welcome you all to today's seminar, given by no one else than our very own Professor Allan Hill. So Allan is a professor of population and international health at the University of Southampton. So Allan joined us in 2011 after a longer than two decade spell at Harvard when he was an undergraduate professor of demography. And he's done lots of fascinating work on sub-Saharan Africa, on Ghana and Kenya, and on the demography of the Middle East, including the Gulf countries, and part of and this is just a snapshot of his very broad interest in demography and demographic methods and applications of those. So it's my great pleasure to welcome Allan. Thank you for joining us for this webinar. And your talk will be about immigrants, citizens, and nationals, how shifting definitions affect the demography of the Gulf states. A very timely topic and something that is really a fast-moving field. So Allan, over to you.
Thank you very much. I'll just share the screen now, and I hope you can see the slides. I'll just make that full screen. Is everyone seeing the full screen there?
Yes, all good.
Good. Right. Well, this is a topic I've been working on for some time, but it has this new salience because of what's been going on, not only in Ukraine and Eastern Europe, but also in the Gulf states, because of various changes, which I will just highlight briefly here. It's tricky working on the Gulf states, and in fact, many of the Arab countries, because they have been resistant to allowing DHS surveys and have been quite protective about their data, with possible exception of Palestine, curiously enough, which possibly from the Israeli example have been much more open about sharing information. So one of the challenges is actually getting access to the data. Of course, many of them are in Arabic, and of course, when the spreadsheets are loaded down, they are organized from right to left, which creates some formatting challenges and so on and so forth. But I think the Gulf states are a really good case study in terms of how countries can deal with immigration and the curious situation with migrants being in the majority, and what that means in terms of the way that immigrants are managed and accounted for. There is obviously a renewed interest in this area. Even the Home Office is taking an interest in some of these issues because of the periodic deportations of large numbers of people, many of whom are suspected will come back to this country. Many of the people who have been displaced have been Palestinians and Jordanian passport holders, and they, of course, are formally refugees, and therefore there is a legal right to accept these people. And of course, the numbers are very large indeed if we did have these larger displacements. One of the problems is the definitions of nationality and citizenship, which we've kind of grown up with, but we've forgotten that in some ways this is quite a new development, where we allow people of different origins to become nationals and citizens. Obviously, the US and other immigrant countries have been leading this, but in many of the Arab countries, it isn't possible to become a full citizen, and the Gulf states have run a kind of duality which persists to this day, and of course is creating a lot of attention over things like the Qatar World Cup and who's building the stadiums and things of this kind. The problem of looking at the demography of the immigrants, particularly since many of the Gulf states have recently decided that it's in their interest to increase the turnover of migrants, not to allow people to settle. And of course, that was the threat of the Jordanians and Palestinians who couldn't go back to Palestine. And they were worried that they would settle because, of course, they bring families and children, and it's a very different population from simply imported workers of different types. So just show you some of the basic numbers here, and there is substantial numbers of people in these small states now. I will own up and say that I was part of the first UAE census. It was called the Trucial States when I was in the Foreign Office. And in 1968, we counted 186,000 people in all 7 states. Now it's 4.1 million. So we really are dealing with extraordinary levels of population growth. And of course, on the right-hand side, you see these large proportions of foreigners. Probably an underestimate, but nonetheless, these are the best data that I can drum up for you. A little bit on the regional chronology and its effects on immigration, because it has affected the way in which the demography is structured. In the early years after the creation of Israel in 1948, there was obviously massive immigration. Kuwait itself discovered oil in 1938, but it was shut down because the decision by the British government, which had responsibility for the external relations of the Gulf states at that time, was to concentrate production on Bahrain, where there was a refinery, and particularly when Churchill decided to switch the British Navy to burning oil. And so it was important to have staging points like Aden and Bahrain to provide oil for the fleet. There was a sort of pan-Arabism early days, and actually the Palestinians were welcome, particularly since they were quite well educated and skilled. And of course, being Arabic speakers, they could teach in schools and take jobs which required literacy in Arabic and in some cases English at the same time. Things changed a little bit after the '67 June War, because there was this division of views as to where the Palestinians stood on some of these issues. And so the impact was that the sponsorship system, the kafala system as it's called, was introduced to manage migration, where basically immigrants had to have an employer who was prepared to sponsor them to come to Kuwait to work. There were other upsets in the region, including the '73 war, oil price hikes, and so on and so forth, leading to a surge in migration, and concerned at this time then about some of the Arab immigrants who seemed as if they were ready to settle in the country and had nowhere else to go. And I think there was a concern about the size of this immigrant population. This came to a head with the Iraqi invasion of Kuwait in 1990. And of course, the problem was that the Palestinians, the PLO, got on the wrong side. And because they'd been heavily supported by Saddam Hussein and Iraq, then became persona non grata, and there was a massive exodus or expulsion of Palestinians and other Iraqi sympathizers. And this led to a revision of labor laws trying to privilege people who'd come from East Asia and South Asia in particular. Now, a couple of interesting things, just to sort of the background of the demography, just looking at the total fertility rates and per capita income. This is just of the nationals. You can see that there is this general relationship between wealth and fertility, but all of the Gulf states, including Saudi Arabia, stand out as having relatively high fertility. These are the nationals only, compared to the levels of income. So it is an interesting population where levels of education and levels of income are very high, but so is fertility, particularly amongst the national population. Kuwait is an interesting case because the way that it was developed, conceptually, the problem was that the oil revenues that began to flow in 1946, relatively small amounts of money to begin with, but the problem was that the funds were building up in the national exchequer, and it was very hard to give money to Kuwaitis in order for them to prosper. The oil industry is quite efficient, and I think in the early years there was something like 5,000 people directly employed in the production of oil. And so that really the only possibility was for the service employment to increase. So what was decided to get the money into the Kuwaiti hands was for Kuwaitis, who were the only people allowed to own land in the old city, this area up here, you can see my pointer, inside the city, the municipality bought the land and property at hugely inflated rates in order to provide funds for Kuwaitis then to go out and build villas on plots of land which were allocated on a lottery basis. And in the municipality, we used to spin the drum on a Thursday morning, and people would draw these tickets, and they became like bonds that could be traded so that people could then buy 1,500 square meter plots and start building villas, and therefore starting off the whole development of the economy. Now, in terms of who the Kuwaitis are, obviously, you can see from the map that a lot of connections with Basra. In fact, the ruling family, the Sabah family, had date gardens and so on in Iraq, and of course, very reliant on Iraq for water. This is, of course, one of the things that triggered the invasion whenever Kuwait decided not to pay the subsidy to the Iraqis in the usual way. So it begins with a very narrow definition of the family and a nationality. And you can see that in the early years, by the Amiri Decree number 15, you could be a Kuwaiti as long as you were resident there from 1920. And after that, it was dependent on who you knew. In other words, there were these committees set up to see whether or not people were recognized. And then there were other changes, including the restriction to nationalities to Arabs speaking Arabic. And these verification committees were set up, which were usually teams of senior merchants and others who then authorized the naturalization of certain individuals. The National Assembly, which was quite a radical body, became involved in this process and tried to admit or refuse certain cases that were then pursued. Now, this then came to a head with the realization that many of the people who were designated as Kuwaitis were actually people who come from Iraq or from Saudi Arabia or whatever, and they didn't pass these nationality tests. And these people were known as bidun jinsiyya, which in Arabic means without nationality. They are not to be confused with the Bedouin, the people who live in the Badia and are nomads. These are a real mixture of people from southern Iraq, southern Iran, many of whom were in the army and the police, because these were not popular occupations for true blue Kuwaitis. And so rather astonishingly, in 1985, it was decided to reclassify all of these people who were kind of category B Kuwaitis. These bidun jinsiyya were then had their Kuwaiti citizenship, however provisional, removed from them. And this then affected the demography dramatically in terms of both the fertility and the mortality, as we'll see in a moment. And in fact, then the subsequent censuses were retrospectively adjusted to allow for this reclassification of individuals. It's something that deserves much greater publicity because it's a very uncommon thing for a country simply to set aside people who had been in the public service, in the army and in the police, and make them non-citizens as a consequence. Now, there were other policies that that affected this, including the whole development of nationalism and the switch to preferential quotas for Asian workers, and of course coming to a head with the expulsion of the Palestinians in 1991. So let me just look at some of the demography and some of the consequences of this moving backwards and forwards with the Kuwaitis. This is obviously the all Kuwaiti population age distribution, but of course it's very misleading because it includes the mixture of these two quite separate groups, the Kuwaitis and the non-Kuwaitis. And you can see obviously a dominant of males because of the predominance of male workers. And here you begin to see some of the issues of these reclassification decisions. Here we've got on the left-hand side the Kuwaiti graph from the last census that's publicly available. You can see that there is this surplus of women in that area that I've ringed, clearly indicating that this is not a population close to migration. There have been additions and subtractions from this population. On the other hand, if you look on the right-hand side, you'll see the very different age distribution of the non-Kuwaiti, comprising basically men and women of working age, with a predominance of men over women. And if we just look at some of these growth figures, you'll see, first of all, in terms of the Kuwaiti population, between the census dates, there were quite regular censuses after the first one in 57, before full independence in 61. And you can see that the natural increase of the population was something like 8.9%, clearly well beyond what we would expect from natural increase. The 57 census included the children ever born and surviving questions, so you can actually reconstruct the fertility and the child mortality quite easily, and you'll see huge increases in population being added to the Kuwaiti core, clearly impossible. Then if we go to the 1980 period, you'll see this negative increase, and that's the result of the reclassification of the Bidun Jinsiya, the people without nationality, in 85. And then you can see some other figures that on the right-hand side, as the Kuwaiti set up a population register for civil information, PACI it's called, and they confusingly have been publishing denominators to estimate vital rates. But of course, nobody's population register is anything like as accurate as the census. And so there's this discrepancy for those who are working in this area between the official figures, which are for administrative purposes, and the census calculations, which are actually much more accurate. So rather difficult to look at longer term trends because of this fluctuation in the composition even of the national population. And just to make the point even clearer, what I've just done is done some inter-census cohort survival calculations. And you can see that in many instances for several of the age groups, the intercensus survival ratios are all above 1, showing that we've been getting additions to the Kuwaiti population for quite a long time. That applies to both men and women. And this is quite interesting because, of course, it allows you, since we've got good vital registration data from about the mid-80s onwards, we can actually estimate who has been added to the Kuwaiti population and who's been subtracted by age and sex, which is helpful in terms of interpreting what's been going on. And of course, mortality has declined very rapidly, particularly childhood mortality. This is from the indirect estimates. But interesting to see how steep the fall was after the beginning of oil production, but starting from quite high levels. And here, just to show that actually, although the child mortality is low, the adult mortality has not been declining as much, partly because of the rise of obesity and diabetes and other conditions associated with overeating and underexercising. Kuwait curiously has declared that the population policy is to continue growth. It's not clear in this policy statement whether they're thinking only of citizens or immigrants, because obviously there are two very different considerations. But you can see that even with the statement that we've got here, we've got statements that the fertility level is too low. So here we've got the summary of what I'd said earlier in terms of the beginning of this sort of apartheid, geographical apartheid between citizens and immigrants, which means that when we're looking at things like household composition, we've got to consider live-in servants and maids who are part of the household and with very different demographic backgrounds. And this is just a sort of a map showing in bright red the areas which are dominated by immigration. That's this area up here on the headland, Hawali and Salamiya. These are all rented apartments. The oil fields are mostly in the south here and in the north. But you can see in these green areas, green and yellow areas, is the majority Kuwaiti population. Over here on the left-hand side, on the west, is a town called Jahra, which is still the biggest collection of the Bidun Jinsiya, the without nationality people, who have rather distinctive fertility characteristics. Kuwait has been trying to encourage the growth of the Kuwaiti population, and including all these generous allowances and so on. But it's interesting that fertility has been declining. This was constructed from the own children methods by the 2011 census. We were able to get some special tabulations to do this. You can see that despite all of the incentives to subsidize the cost of childbearing, it seems that Kuwaiti women are leaning towards smaller families. Here's a more detailed calculation from the national statistics, which show the recent decline from 2012 down to a total fertility rate of 3, still very high given the levels of education and wealth of this population. Interestingly, the trend in fertility has been quite flat, even through the period of the Iraqi occupation and the recovery, because as you remember, the Iraqis set fire to the oil wells on retreat from Kuwait, and this obviously affected not only the environment, but obviously the income from oil production. But there seems to be sort of a delayed effect on fertility, which is an interesting feature that isn't fully explained. We were able to do a small survey in order to look at some differentials in fertility, and there are differences in fertility depending on not whether Kuwaiti women are in the labour force or not. There aren't many people who are active, and there's a large fraction in the census where men and women have declared that they are able to work but unwilling to work. They don't need to work because they're well enough off. It's an interesting category you don't often see in censuses. But you can see that there is this gap in terms of occupation. And also, when we look at the geography, this higher graph, the dark blue one, is the one for this place called Jahra, which used to be a camel market west of Kuwait, where the fertility amongst this they were category B Kuwaitis, but they're now Bidun Jinsiya, and some of them have residence permits and so on. A lot of them, if they were suspected of collaborating with the Iraqis, were deported. So this whole deportation strategy is something that the Gulf states are not very keen to have people working on, because it's something that they're not terribly pleased about others finding out. So here we've got small reductions in fertility, but still with a desired family size of over 5, and some differences by residents particularly. But there doesn't seem to be any clear link between the availability of domestic servants and the availability of fertility. So just thinking about whether childcare costs are affecting fertility. This is, of course, a different level of income from what we're used to here. So turning to the non-Kuwaitis, this is a much more difficult population to look at because of the changes that I've outlined. But if you just look at the number of births without just looking at the rates, you can see that some of the more settled populations, including the Egyptians and the Indians who've been there for many years, are contributing more of the births than other more mobile groups. And of course, the numbers of Jordanians and Palestinians have dropped dramatically as a result of the deportations. The composition of the non-Kuwaiti population has changed dramatically. You could see in the early years, a lot came from Iraq and Jordan and Palestine, but also from further down the Gulf. Before Oman discovered oil, the Omanis were doing a lot of the heavy lifting. But what has happened recently, you can see just in red here, the proportions Asian increasing all the time. And the tradition being that you're working through labor contractors who then arrange for short-term contracts. In other words, it's not an individual migration. It's a very different pattern of movement from the Far East to the Gulf states, quite controlled and unfortunately very expensive because of the role of middlemen and women in this whole process. On paper, the Kuwaiti government is committed to keep the Kuwaiti population at 40% of the total population, and it tries very hard to select people. It's still in Kuwait, it's still, and the Gulf states, it's still possible to deport people by administrative order without having to go to a magistrate or a court. And also health tests are applied. Anyone who's HIV positive is banned from having a visa. So all of these factors mean that the non-Kuwaiti population is highly selected. So when we come to look at their mortality and their health, we have to realize that we're looking at a very strange subset of the migrants when we're looking at these people from the Far East. Now, the Bidun Jinsiyya is interesting because you can see that the numbers are quite substantial. It was estimated there was as many as 250,000 in 1990, and that number dropped dramatically despite their contribution to the war effort and in the police. They were regarded as being pro-Iraqi, and so this committee was set up in order to try and regularize the status of the Bidun Jinsiyya, because it's not clear how they should be reported in the censuses and in the vital registration data. It's become more restrictive in terms of things like children born to Kuwaiti women and to a Bidun man. For example, this last nationality law means that the children are considered stateless, and that some women felt compelled to divorce their Bidun husband so that children could be granted Kuwaiti citizenship. Clearly, rather draconian measures, and something that, as I say, it's quite hard to get information on because this isn't a popular topic for research. But just going back to the demography and seeing what happened, here is the break in '85, whenever the Bidun were reclassified, and you can see this is just the registered deaths, and you can see this navy blue line here at the top is the Kuwaiti male deaths, and this huge drop because of the removal of the Bidun from this classification. Same thing with the Kuwaiti females in this pink line, this huge drop. And then, of course, picking up on the other side with here we've got the non-Kuwaiti males in green. You can see this huge drop in the number of deaths because of the reclassification that took place. And you can imagine what this does to life table calculations and other demographic rates and ratios. The non-Kuwaitis have been growing quite rapidly. I think I've covered this already. But the labor laws and the migration system has become really involved, including things like some contribution towards the changing an employer, so that there is some sort of a labor market rather than this sort of feudal system where people are admitted on a particular visa for a particular job and aren't allowed to change jobs. And that obviously leads to a lot of abuse, and there's considerable unrest amongst certain female workers in particular, who obviously are both domestic maids and working in the hotels and in the service industry. And it's interesting to see that when we get complaints from India or from the Philippines about the mistreatment of their workers, very often the sending countries are silent on this because they realize that the remittances are so important to the domestic economy. They really don't want to interfere in this area. And so obviously labor is not allowed to unionize. And there's also an issue of who pays for the return fare whenever the contract is ended. All sorts of rather uncomfortable realities for many of the Gulf states. And I think it certainly deserves greater attention, not only because of the human right aspect, but because of the impact on other countries in terms of their fertility and the mortality, particularly since we're getting women who are clearly married with children who were part of the service labor force. And therefore, we will wonder what goes on at home in terms of childcare and so on, given that these women are often absent for many years at a time. And going and coming is not so easy, not only because of the costs, but also because of the visa restrictions. So people's visas may be invalidated if they leave for a holiday or return home to see the children. So quite a lot of legislation involving the kind of requirements. Here we've got this health insurance certificate. It's very two-tier in terms of access to education and access to health. And that obviously affects some of the outcomes, but because of this selection, we see that quite a lot of the migrants are obviously have to be in good health in order to maintain their visa and their residence in Kuwait. Sorry, if we just look at the age-specific fertility, this is the non-Kuwaitis in Kuwait. You can see it's a very odd pattern where we've got a few nationalities who are able to bring their wives and are able to have children in Kuwait. But of course, the free maternity care and so on isn't extended to the non-Kuwaitis, who would then have to use private hospitals and clinics in order to have these children. So, and just to sort of bring this to a conclusion, so far there's been resistance to further liberalization of the rules on immigration. You can see that with the policy to try and encourage Kuwaiti participation in the labor force not working, there is still a pressure on the immigrants. There was an attempt to limit the number of maids per household in order to restrict the number of non-Kuwaitis in the country, and that produced a huge uproar. And many Kuwaitis said that they couldn't manage without the level of support that they were used to. So we've got this apartheid system which is developed, and it's very uncomfortable for the states to own up to this, because of course they want to be seen to be doing things properly, but the way that the visa rules and the way the industry has grown up around immigration, in a way, it's not so much the Kuwaiti government that's involved, that's in control of the numbers coming and going. It's very often to do with employers and with associations with the labour importing organisations. So I think a fuller study would need to involve some examination of what's going on in the sending states. I mean, there are particular parts of India, particularly parts of the Far East, where we know large numbers are coming from, and I think these would be very interesting studies. Here you can see just some of the other discriminatory legislation, particularly for these Bidun Jinsiya, these people in this sort of twilight zone. They're neither non-Kuwaitis and they're not really fully Kuwaitis. And you can see that there's all sorts of discriminatory consequences that, for example, around driving and recruitment into the public sector and fees for access to the public hospitals. There's a whole series of labour laws and migration, which I don't think anyone would find defensible in terms of the way that migrant labour is treated. So what we've got here is failed nationalisation of the labour market. There are, as I say, in the census, large numbers of Kuwaitis who are able to work but don't need to work because they're so well off. And there's a whole question of naturalisation, which, given the unfamiliarity of this concept of citizenship, I think is very much out of the question. So I don't know how this is going to be sustained longer term. Obviously, places like the UAE are even in a more vulnerable position, UAE and Qatar and so on. So in conclusion, I've come up to the end of my time. You can see there's this clear mark of policies, politics and economics on the demographic record. As here, we have this conundrum of how to define nationality and national identity. And I think that this is something that goes along in parallel with the whole business of labour law reforms, where in a sense, the ILO and other bodies hasn't done a really good job in holding countries' feet to the fire in order to make some modest changes that would make migrant work, which is obviously going to continue for some time, a little safer and a little more secure for people involved in both ends of the process. I will just acknowledge this at the end, because one of the things that drew me to this particular topic, apart from having written my thesis on this many years ago, was the claim for compensation against Iraq by Kuwait. And we were involved in doing some arithmetic in terms of measuring the impact on Kuwait and how much could be extracted from the Iraqis in terms of compensation. So I'll finish there.